After an injury of any kind, you're going to get inflammation in the area. Inflammation can cause more inflammation. It's one of these cyclical things that can be damaging over time. There's also this thing called the gut-brain axis, which we're learning more and more about. Through the vagus nerve, it goes down to your gut. And your gut lining only allows certain things to pass through it. So when you eat food and it goes down and it's getting digested in your system, there's only certain amounts of those things that are allowed to come through to your body and get into your systemic circulation to give you nutrients that you need to run your body. If your gut lining gets inflamed or damaged based on the foods you're eating, things like alcohol and pro-inflammatory foods over time can actually damage your gut lining, which means that now because there's more damage there, you have more what's called gut permeability. So now foods that you're eating, now instead of getting little tiny molecules through, you're starting to get big chunks of things through that your body actually sees as foreign. So now your body attacks it, that mounts an immune response. That immune response can also create kind of systemic inflammation throughout your body. Systemic inflammation throughout your body, no matter what the cause, will make you feel foggy, anxious, lethargic, have memory impairments and cognitive decline and all these things. Personal story, I changed my diet a few years ago, and after about a week, I was like, oh my God, I was waking up so clear, and I didn't even know I was foggy. Right? So you might not even perceive this, but the treatment for this is actually changing your diet. Eating clean, clean, clean. Clean AF is what I have it down as in my notes. Eat clean AF. Because what this will do is help to repair the gut lining. Eating pro-inflammatory foods will actually keep damaging the gut lining. And after a brain injury, after concussion, you actually increase the permeability of your gut lining. So if you had any type of gut inflammation before, it's now way worse. So even foods that didn't bother you before, all of a sudden start to now become problematic. So you might notice that after your concussion injury, you're starting to get a lot of GI symptoms, a lot of stomach upset. Foods are starting to bother you when they never did. So the way that you can do this is to go super, super, super clean. And you have to be 100% committed to this. I've had Dr. Herkel on our podcast, and I'm going to have him on again soon to talk about this stuff because it's super, super interesting to me, but also all of you. The main things to avoid are alcohol, because alcohol can impair and damage the gut lining. Gluten, just because it's a common sensitivity and pro-inflammatory. Dairy, again, common sensitivity, pro-inflammatory. Refined sugar, okay? Anything with any sugar, if you're looking at a package and it says sugar on it, you're out. You can't have it. If you want to throw, oh, I just put a little scoop in my coffee, you've already cheated. Oh, I just had one little piece of chocolate, cheated. You have to be 100% all in committed to this because, and the way Dr. Herkel has described it to me before is if you do 95% of this diet, you're going to get 10% of the benefit. You'll see a marginal improvement. But the thing is, most people don't go all in. Even my own patients, I tell them to do this and they're like, oh yeah, I've been following the diet. Oh, okay, no cheats. Well, I mean, I still put sugar in my coffee. Well, then you've lost, right? That little bit of sugar has just completely undermined everything you've been trying to do. Dr. Herkel says if you do 100% of the diet, you will get 100% of the benefits. So don't complain to me that you still have symptoms if you're not following this diet 100%, eating clean as hell. Another one that I put in there that actually got a lot of questions when we put it in is eggs. And I'll just kind of explain that one because eggs are a very healthy food, but it is one of the most common food sensitivities. So people that, and I, for one, am one of these people. I used to eat eggs every single day of my childhood and all the way up. And about first year of chiropractic college, I started getting all sorts of GI symptoms and all this stuff. And we did all sorts of exploratory stuff. Finally found out when I cut out eggs that everything went away. So I still don't eat anything with eggs in it because it affects me. I have a sensitivity to it, but I didn't know that. So because it's one of the most common food allergens, we have people also eliminate that. Now, I will say this diet is not something that you follow indefinitely. This diet is simply meant to be a very short-term thing. Basically, you go on this diet for like 4 to 6 weeks, and then you start reintroducing things back in. Another way to look at this is to Google like low inflammatory diet or anti-inflammatory diet, and there's recipes on there and all sorts of stuff that you can check out just to try and see if it does anything. And it takes some time to get into. But once you, is this one ringing or something? Don't call me. I'm in the middle of something. Huh? Oh, is it really? Sorry. Anyway, so where was I? This diet is not something that you follow indefinitely. You do this for a short period of time and see how you feel. And then you gradually reintroduce things back into it to see what that does to you. Okay? I would also say that this should be managed by a healthcare professional as well. Okay, don't do big drastic changes without having some sort of guidance on this. A lot of this stuff is safe. It's really how we should be eating anyway. It's just nothing that's refined or processed, right? You're not getting sandwich meats or anything like that. Just think about it this way. You're eating whole meats, preferably organic type meats, antibiotic, hormone free, and you're eating fruits and veggies. That's it. If it comes in a box, it's probably not allowed.